For Dr. Laura Ricevuti, it's not easy to recount the moment that changed her life and the fate of the country forever, receiving news that her patient was the first in Italy to test positive to coronavirus.
My God.
I said, oh my God. And from there it was something awful. It was a bomb that exploded.
38-year-old Mattia Maestri was admitted to Codogno hospital with pneumonia, high fever and a cough. After a series of tests failed to reach a diagnosis, Dr. Ricevuti and a colleague decided to swab for COVID-19. That was the evening of February 21st, 2020, the beginning of an unthinkable crisis.
We had to gather all the resources psychologically, physically, and also organizationally to confront an emergency that we couldn't believe could arrive so quickly.
The town of Codogno was immediately locked down and declared Europe's first red zone.
It
is still difficult to digest what happened on February the 21st. I get goosebumps when I think about it. Within hours, we were discovering that the virus was widespread among us.
16 days later, the entire country was in lockdown. In that time, Dr. Ricevuti was also hospitalized with the virus. Thankfully, she and Mattia managed to recover, but so many others didn't, including colleagues.
The real heroes are them. It's not us.
A memorial stands in their place.
This is our place to remember the many people who unfortunately didn't make it through this battle, but it is also to recognise the resistance and humility of the community.
Due to new variants of the virus, Italy is now battling a third wave of infection. More than 100,000 people in Italy have now died from COVID-19 since the beginning of the pandemic. And with cases on the rise again, new red zones have been declared across the country. Doctors say the emergency is far from over.
There is still the pandemic and still the emergency. Everyone needs to do their part or we will never see the end.
A plea that couldn't be clearer as the world officially enters its second year of the pandemic.